if better ways exist to prevent diseases like type 2 diabetes, it could save lives and money. A model developed at UT Austin uses artificial intelligence to create better outcomes and save costs for pre-diabetic patients. The person who created this is joining us now live. Maytal Saar-Tsechansky is a professor of information, risk, and operations management at the Macomb School of Business. Maytal, thanks so much for joining us. We appreciate it.
Thanks for having me.
You know, how does this technology predict which patients are most likely to benefit from a preventative treatment?
So let me maybe quickly share a little bit about what we mean by preventative treatments or examples of those. So there are many preventable conditions like type 2 diabetes for which there are many low-risk interventions, like even moderate lifestyle changes supported by a coach, a personal coach, can effectively reduce the risk, meaningfully decrease the risk for some patients. What the algorithms do is they find patterns in medical records of patients that are similar to you, for example, some of whom received the treatment and some of who didn't receive the treatments, and whose outcomes can be predictive of our own outcome as a result. So we can find what was the likelihood of disease onset for people who are similar to you, who received the intervention, and compare it with the outcomes of those who didn't receive the intervention. The degree of reduced risk is basically the benefit. And the key is that really those predictions can be based on quite personalized, and that's kind of really a key issue here, quite personalized characteristics that we can find in medical records. So we can make those predictions for specific individuals, and they can differ. The risk reduction can really differ across different individuals. Essentially, people are, the key here is also to appreciate how much information about our medical history is actually important to bring to bear to assess that the impact of preventative or differential impact, rather, of preventative or different preventative interventions are for different patients. And medical records can be quite key. A lot of people are very concerned about their privacy, which are, these are important concerns that need to be brought to bear. But people need to also realize, both policymakers and individuals like us, it's important to realize also the value that we can all gain by having that kind of information that can later be brought to bear to benefit our life expectancies, our quality of life, through, for example, this particular method that we developed.
Yeah, well, thank you so much for that context and insight. And I only have time for one more question for you this afternoon, but how will this help reduce long-term costs for the U.S. healthcare system?
So for the U.S., there are hundreds of billions of dollars that are spent every year on preventable conditions, but preventative interventions are not really allocated very efficiently. They don't get them to the people who needs them, because the assessments, the prediction of who benefits from them are lacking. And as a result, we don't have good ways to allocate budget for these interventions effectively. So essentially, because we don't know who's going to benefit the most from those interventions, people who need them or can benefit from them the most do not get them. If we do get those interventions to the right people, we'll have fewer people with those conditions. So just the cost of treating chronic condition is going to go down. But there are also other effects, because these people are going to be giving back to society, giving back to the economy. There are things that we're not even quantifying, which is the quality of life, life expectancy, and what these people can give back to the economy, which is substantial.
All right. Well, Maytal Saar-Tsechansky, thank you so much again for joining us and talking about this really fascinating stuff. We appreciate it as always.
Thank you.